Hi, and thank you. I just realized that having coffee and 5-hour energy before you present is not a good idea. Thank you to Tom and Marcia and the entire Cypress crew for putting this on. This is our first time to be here, and it is a wonderful program, and we're very thankful to be here. I could stand up here and talk about medical concierge and try to explain it, but I have a video that I think does a wonderful job that I'd like to play for you.
Welp, looks like there's no option. You have got to get that fixed. What else is there to know, right? Well, for medical attention that is not an emergency, if you want to avoid this gigantic bill, here are 3 things you need to know. Number 1, you do have options. Sure, your doctor gave a perfectly good recommendation, but he's not familiar with your medical plan. Nor is your plan limited to a certain hospital, certain surgeon, or certain day. That brings us to point number 2. These options can affect your cost. In fact, a hospital or medical facility that is nearby could have had a lower price for the identical procedure, and the hospital on the other side of town could get you in sooner and at half the price. And since more expensive doesn't equal better quality, you could probably get a better deal and maybe even better treatment. But on your own, you might not be able to find the information you need, let alone make sense of it. That brings us to point number 3. The medical concierge can negotiate the best price for you. And thanks to your employer, it's 100% free to you and anyone covered under your plan. We know your situation and your coverage, so when you call us up, we'll get the necessary details from your doctor, do all the research for you, and walk you through your options, highlighting both the best prices and top quality providers, and maybe even getting second or third opinions on certain procedures for free. So no, you don't have a choice about needing to have that procedure done, but you do have a choice about that bill. So save this number in your phone and give us a call, and let us help you make the best choice.
And that's all I have, and thank you. No, I'm just kidding. You guys couldn't be that lucky. As Tom mentioned, I'm with Akeso Care, and we are a full medical management company. But today I'd really like to focus on our medical concierge program, since most of the talk today has been around cost containment. Our medical concierge service is open to anyone that's on the insured plan, on your self-funded healthcare plan. Our goal is cost containment, and we do that through being an advocate for the members. I don't know if any of you have ever tried to call up a provider to see how much something costs. And we're in the insurance industry. You know, we know the language, we know what we're talking about. But leave that to an insured, and they have no idea where to begin, as you saw in the video. So what we're trying to do is we're trying to find the insured's the lowest cost, highest quality provider for any test or procedure that's non-emergent. You'll find that there's no correlation between cost and quality. Unlike, in our everyday life, we're brought up thinking, oh, you pay for what you get. So the higher price I pay, the better service I get. As we found in the healthcare, that is not true. There are providers who have a lower cost, and their quality is a lot higher. A couple different ways that this works is we can either use this through member-driven, or if you have a pre-cert, if we're your pre-cert vendor and a provider calls in to pre-cert something, then we're able to reach out to the member. So what we often recommend is that you expand your pre-cert list to cover things like MRIs, colonoscopies. So the provider will call in, and then we'll reach out to the member and say, we understand that you're having a test or procedure. We can help you find a lower cost facility that might be closer to your home if you're interested. So then we do the research, and we provide the insured with options. This is a voluntary service, but at least we've given them information so that they can make an informed decision. A lot of times, as I mentioned, this is a member-driven program, so we ask to have as much time as possible. So we ask the member to call in as soon as they know that they're going to have a test or procedure. And oftentimes, we'll get a call, and a member will say, I need an MRI, and they're not really sure, what kind of MRI, or maybe it's even a CT scan. So what we do is we get the name of the provider who has subscribed this, and we make an outbound call to that provider. so that we can get the exact information. There's out there, MRIs, you have open, you have closed, you have certain areas of the spine or that need to be focused on, and insured often doesn't know that. They just hear MRI and they think that there's just a common MRI out there. So we'll call the provider, get all the information, and then we'll look in that area for highest quality, lowest cost providers that can also do those services. We'll provide the insured with a comparison report, kind of explain, let them understand, the difference between a hospital or an outpatient facility, and then ask them if they need help scheduling the appointment. So that's kind of how the service works. I have a couple examples where we have had some impact. The first one is a shoulder surgery, and in this situation, we were actually able to redirect and negotiate from a hospital to a freestanding surgery center that was actually out of network. We try to stay in network as much as possible, but there are those options where a lot of times the out-of-network provider really wants to, wants the business, and they're willing to negotiate with us. So for this example, we were actually able to save the plan $40,000 and going out of network. The second example is just an MRI, and as most of us know, your local hospital, if you can just divert that to a freestanding facility or even an imaging center, then you're going to save money on that. And in this situation, we actually have a concentrated area where we have several employers, and we've worked with an imaging center where they were able to give us some discounted pricing below the PPO. And so we drive most of the imaging there to that facility. So the MRI was able to save the plan almost $5,000. The third example, again, is just another example of redirecting somebody from a hospital to a surgery center. And I think a lot of times when we're talking to insureds, we explain, if you go to this surgery center, you're able to park closer. You don't have to walk as far. The facility is more concentrated. And actually on this situation right here, we called the provider to ask them where all they had affiliations, and ask him if he was able to perform this at this surgery center. And he said, oh yeah, he said, actually I like working with that staff a lot better. So just by asking the question, where all do you have affiliations, we were able to save the plan $37,000. The fourth scenario I really like. Again, I mentioned that this is a member choice. So the husband called in, and this is actually a Cypress client. The husband called in and he said, I need to pre-cert. And he said, but I don't want any research or redirection, thank you. So we take the information and we go ahead and we start the research anyway, because what we like to do, even if somebody refuses to be redirected, we'll do the research, we'll provide them an example, and we'll either email it or send it to them. Again, a lot of this is about educating and empowering members. So we want to at least get that information in their hands so that the next time they're able to, maybe have more comfort in contacting us. So this insured called and he said, I'm not interested. And his wife called back and she said, do you still have that research information? Because yes, we're going to look at that. So we were able to redirect this member from a medical center to an outpatient imaging center, save the plan $1,500. A lot of times it's those little things, the MRIs, the colonoscopies that we do a lot of. And that $1,500 is not a large savings, as you saw with the shoulder surgeries or what we're able to do through host care, but those add up, and they do help the plan. So to kind of summarize, this is a member-driven program, and we know that member engagement is tough. So if we can expand the pre-cert list to cover those outpatient procedures and tests, MRIs, colonoscopies, then we're able to also reach out to the member when a provider calls in. It's anything that's non-emergent. A lot of times, insured asks us, well, how much time do you need to turn this around? We like to have 24 to 48 hours because we're going to make an outbound phone call to that provider. We want to get all the information because we're looking at this on the CPT level. So we're digging down to that cost difference. We do some research, and if we have the opportunity to negotiate pricing, we do that as well. And then our ultimate goal, we want to be that early identifier. So, a lot of times before somebody has knee surgery or hip replacement, they're going to have events along the way that you can kind of tell are going to lead up to that. So whether it's, you see some physical therapy, some injections, MRI, we know that, the next step is probably knee surgery. So we want to get in front of that, and if it makes sense to keep that individual local, then we want to try to find a provider that can provide that at a low cost. If the insured or if the procedure makes sense to use a host care, then we want to help direct that member that way. The program works best a couple different ways. It really works best if you do an incentive and a penalty. When I talk to employers and brokers, you're going to see the greatest savings if you put some sort of penalty in it, but we all know that we don't want the employer calling us on the phone complaining because their employees are upset. So we often encourage them to do some sort of incentive. So whether that's waived deductible or coinsurance, cover something, at a higher copay, then we encourage you to do that. With the penalty, what we say is, the penalty is if you don't call. We shouldn't put a penalty in place. This is a member's choice. So we just want to get people to call us, because once we can start educating them and talking to them about pricing difference, then we're able to make a greater impact. I know prior to me being in this industry, I thought, all prices are the same. And when I actually started doing some of the research for this, I was just amazed at $300 markups on certain things. So it's very eye-opening. Oftentimes, we get the question, well, are you able to show real savings? So I have a couple of examples here. This first example is a school system, actually in Indiana, and this has a penalty in place. So the penalty was you had to call the medical concierge at least 7 business days before you'd have a test or procedure. Don't have to take the recommendation, but you at least have to call. So that's why you're seeing such a high ROI, 35 to 1. The second one is a group that is a government. This one is also in Indiana as well. So we have 762 lives, and we're looking at a planned savings of $82,000. We can also do nonprofit. Our book of business is quite extensive. And a lot of people ask me, well, how many lives does it make sense to use this on? And as you can see here on example number 4, 29 lives. It doesn't always work great on the smaller groups. However, if you can divert one knee replacement, a couple colonoscopies or MRIs, then, that pays for this service a couple times over. Our medical management team, we are a fully staffed medical management team. So we have 28 nurses who are on our staff. We have a medical director who is on site. Probably by the time we take our pre-cert and our medical concierge, we have about 15 representatives to take phone calls. And then we also have a couple billing specialists that are on site. A lot of times, it really takes a person who has the science of coding. It's hard to understand, and a lot of times things get bundled together. So the billing specialist is able to kind of say, okay, all in this cost for an anesthesiologist, the provider, we heard price for sutures and things like that. So she's able to kind of help us and support us when we're looking at the cost comparison. So a little overview of Akeso. We are a subsidiary of IMG International Medical Group. We also have a stop loss within our company as well. We were founded in 1996 to provide cost containment to IMG for our international book of business. So, we know what it means to work to contain cost. We're URAC accredited. So we do the pre-cert, UR, case management, disease management, and wellness. The reason why this kind of works so well is, when that first call comes in, whether it's a member or a pre-cert, then we're looking at the entire episode of care. Where can we affect change and help drive costs down? So if it's, disease management, that might help, or if we need to push it towards case management, we have all of that staff and services right there. We've been serving external clients since 2003, and we are in all 50 states. And then, as I mentioned, we are an international company. So I always say that, if you can understand the international side, the domestic side is a piece of cake. And that's all I have. So, thank you.